Hi, my name is Aileen Tran, and I'm an MSN candidate at the University of San Francisco in the Clinical Nurse Leader program. This presentation is to discuss the clinical nurse leader, their responsibilities, and the capacity in which they can be seen in hospitals, including my own hospital that I am currently working as a med-surg nurse. There are a few key words that I feel describe a CNL very well. These words are as a liaison, as a coordinator, as a facilitator, as a delegator, as a patient advocate, evaluator, and a researcher. So before I can discuss how I see the need for a CNL at my hospital, I'm going to discuss what exactly a clinical nurse leader does and what are their responsibilities. The CNL is a clinician who brings the locus of control for safe and quality care from the administrative areas straight to the unit's providers who deliver the services. And this was stated by Reed and Dennison. What this means is that the clinical nurse leader works directly in the clinical setting. The responsibilities of the CNL are as such. The CNL provides and manages care at the point of care to individuals, clinical populations, and communities. CNLs anticipate risk and implement care plans to minimize risk. They use information collected to tailor treatment plans for individuals and clinical populations. They advocate care for patients and communities. They integrate technology and innovation in treatment plans. They also coordinate care between various settings, a term called lateral integration of care. They implement evidence-based practice in care, provide leadership at the clinical level, and ensures the safety of the care provided at the clinical level. They also act as a liaison between members of the healthcare team. So to sum it up, pretty much CNLs work at the clinical level, and as I put it, basically an all-around caregiver. As I mentioned earlier, I believe that my hospital can benefit from having a CNL in the workplace. We currently do not have a CNL in my workplace. I believe a CNL can help increase communication between those working. I believe that having a CNL can increase communications not only with the nurses on the floor, but between nurses on different floors, in things such as giving report, helping out in code situations. There's a lot of confusion because there's not a clear distinction of the roles. Having a CNL would help define the roles and help people be on the same page. Also, a CNL can help incorporate evidence-based practice. An example of this would be, I've noticed that the policy of my hospital is to change IV tubing every 5 days. I had previously read a study stating that 3 days had been proven to decrease infection rates. As a CNL, it would be my role to look at this information, look at this evidence, and research further to see, is it really more beneficial and cost-effective to change tubing after 3 days, or as my hospital currently has it, 5 days? As a CNL, it is my role to use evidence-based practice and bring it into the workplace. Also, my role as a CNL would be a resource for information. It would allow the members of the team to come to somebody to provide them with information and point them in the right direction. My ultimate goal with my CNL certification would be to be a nurse educator. This would combine my love for nursing and teaching. This would allow me to be an aid in providing nurses with new education, the latest in evidence-based practice. This would allow me also to work and provide the entire healthcare team with methods to better communicate and work together, as well as working directly with patients, their families, and the healthcare team. I would also consider in the future possibly being a clinic manager or unit manager. As a CNL, the possibilities are endless. My references are as follows. To summarize, a CNL's role is to advocate for the patient and the population by helping the healthcare team work together and incorporate the newest evidence and technology into their care. This would result in better care for the patients.